What role do you think doctors have in the opioid epidemic?
Well, several roles. One is we can diagnose it. When we see a patient in the office, we have to ask them about the issue. And we can usually ask them directly or indirectly, get some clues. But there's nothing wrong to ask a patient whether he or she takes illicit substances, whether they have a problem with addictions. It's pretty easy to determine that. So that's one thing. So once we know that they do that, we can offer them various treatment options. And it would be better if physicians had referral sources, colleagues, institutions that they can work with to help the patient. So we have to develop a team approach to take care of our patients.
And how about the issue of helping patients avoid getting addicted to prescription? Do you think doctors have a role in that?
I think doctors do have a role in that, but again, it depends where you are and the patient. I'm not sure if we can really do too much with that. That, to me, belongs more in the social circles that the patient has, their economic situation, their social family situation. Very difficult for a doctor to prevent that. We see people once they have a problem.
But how about when you're treating pain? And
yes,
that's a different issue, right?
Oh, absolutely.
But that is involved in this.
No, thank you. So the role of a physician is also to educate the patient about what may or may not happen with any given treatment, including the use of analgesics, narcotics. So yes, absolutely, we should tell them that a medication like this is only useful for a few days for this indication, and that ultimately they will have to transition to a different approach if they're still having pain. Absolutely, we need to educate the patients about that.
And do you think the doctors have to modify their habits with prescribing less?
Yes, absolutely. There's very few indications where you really need a narcotic. Certainly there are very limited indications for long-term narcotics. Those indications are really essentially patients who are terminally ill with cancer pain. That's an indication for a long-term narcotic. But otherwise, there's very few times where a patient may need a narcotic for more than, say, a week. Most of them only need it for a few days.